I hope everybody's doing okay. Hope you can hear me. I got headphones in because people are going to be coming in and out of my office here as we talk. So I wanted to talk to you today. I want to go over what's the deal with all these stem cell clinics, right? So it seems like not necessarily here in the Middle Tennessee area, but all over the country, it seems like stem cell clinics are open up all over the place. And there's articles that show up in the news and things like that say, what do you got to know about these stem cell clinics that are popping up all over the place? Well, a couple of things, and I'm going to give you my opinion on this only. You guys can take it or leave it. All right. So, first of all, stem cells. I have in the post there, it says you want to know what the FDA is saying recently about stem cell and what the future may hold for this therapy. So let's talk about that first. So stem cell therapy, in December of 2017, the FDA published their official position paper on stem cell therapy and stem cell clinics. All right. And what they did is they came out and they said, we are going to regulate stem cell differently. And some of that's good. You don't want people out there that are just selling a product saying that it's stem cell when it isn't. You don't want people making claims that they can't back up. And certainly you don't want people, especially people that are suffering, to spend hard-earned money on something on a hope that it may not come to fruition. So anybody who's going to make you a promise regarding stem cell success is actually violating the law. I'm not saying that they shouldn't be giving you some hope. I think that hope is one of the greatest emotions that humans experience, and that you should have hope about any condition, because the truth of the matter is the body's made to heal. God made the body to heal, and you should you should have hope that you can get better. Anybody who tells you you can't get better, I also believe they're lying. But let's face it, the medical community in this country does not like the word cure. They don't like it when we say we can cure something. So therefore, stem cell therapy is one of those things that, generally speaking, the FDA, even the FTC, and the Federal Communications Commission doesn't particularly like. They don't like the stem cell because it upsets the medical apple cart, if you will. What it is, and this is pretty well known and well researched at this point, but stem cell therapy is the greatest discovery in treatment in our lifetime. All right, there will be no greater discovery regarding medical treatment and care in our lifetime. Now, it doesn't mean there aren't great medical discoveries in our lifetime. There's the MRI. The X-ray was discovered in 1895, so that's not necessarily in our lifetime for most of us. If anybody, wow, you'd be pretty darn old if you were alive in 1895, but you could be the world's oldest person. So in our lifetime, there's been some pretty amazing discoveries in medicine as it relates to medicine, but mostly in diagnostics, not in treatment. So when it comes to treatment, the greatest discovery that we've ever seen is stem cell. This is how you could take your God-given abilities, harness those abilities to actually help you regenerate your body. Now, why would somebody want to squash that idea? All right. What do you think? Just guess. Somebody post on here, a few people watching. What do you think? What's your best guess on why we would want to squash the idea of your body healing itself? There's a few people watching at the moment. Well, we won't keep you guys waiting. The truth of the matter is it's money, right? So if somebody could be fixed, why would you need medication? Why would you need to keep seeing a doctor if you could actually fix things? So as I said, December of 2017, the FDA came out and they said that stem cells can really only be called stem cells if they comply with very, very specific medical language or medical jargon. And those two words, not trying to give you a bunch of medical words here, but you should know what they are. It says one of them is it has to comply with the definition of something called homologous use, which means the donor tissue has to do the same thing in the body of the recipient tissue. So if we took your fat tissue and we spun it down and got your stem cells from it, this is called adipose-derived stem cells. So if we did that and I injected your stem cells from your fat tissue into your body, into your knee or into your shoulder or something, the FDA says you can't do that because technically fat tissue doesn't do anything for a knee joint. So adipose-derived or fat tissue-derived stem cells is no longer considered a valid form of therapy unless it is regulated and in coordination with FDA clinical trials. So you have to register that treatment with the FDA. The problem is that I have with that is the FDA is there to regulate and sell drugs. They don't really do a whole lot for our food supply. Most industrialized countries have better food supply than we do. Much better regulated. I mean, it's not many less toxins than what we have in our food supply. So I don't believe that the FDA is out for our best interest. You know, I can probably get a knock on my door now that I'm saying all this online, but I believe it's the truth. So the FDA says if you use adipose-derived stem cells, that's kind of against their rules anymore. So what you have is you have another definition, and that is that a tissue from a donor, such as, let's say you got stem cells from somebody else, from cord blood or from amniotic tissue. And if you got that, what you would have to see is that tissue, even if you got it from yourself, actually, the tissue before it's injected back into the body has to be something called minimally manipulated. So it can't be changed or altered in any way before it gets put back into the human body. So if I took your bone marrow and I spun bone marrow tissue and spun it down, that's okay. That's considered minimally manipulated. But if I take your fat tissue and I spin it down, I have to add a solvent to it to get a chemical to it to get the fat tissue to let go of the stem cells. And as soon as I add that solvent to it, it's called minimally manipulated. And the FDA says now you've created a drug, and that is against the law. So all of this has come down in an effort to, quote unquote, protect the population, protect the human population, the U.S. population from cheats and charlatans and snake oil salesmen. And those are what is put on the cover of all these articles. In an article I saw that was put in the Washington Post recently, it said, these stem cell clinics popping up all over the place, are they regulated? And the truth of the matter is they are regulated. You can't, the tissue is completely regulated. The product that we use in our office is actually, it is on label for orthopedic issues. So there is quite a bit of regulation. Everything has to comply with the American Association of Tissue Banks and the United States Pharmacopoeia testing. Like, this is really, really well tested and well researched information, but it does not sell drugs. Okay, it doesn't promote a surgery. It doesn't keep people in the system. Okay, and so if your goal is to get out of the system, you're going to have to think differently. All right, you're going to have to think differently. Unfortunately, because it's not in the system, it also isn't covered by insurance. So some people, some doctors out there have really gone way overboard and charged way too much money for this type of therapy and treatment. And that's given, it's just given fuel to the fire to the FDA and the powers that be to say, oh, we're cheating people. The truth of the matter is, when a knee replacement surgery costs around $86,000, and in that knee replacement surgery, you have less than 1% chance of that knee replacement surgery going bad per the medical definition. So per the AMA, you have less than 1% chance of failure of that knee replacement. However, statistics right now, you're welcome to look this up online, check my math, show that 59% of the population that gets a knee replacement surgery is unhappy with it. So the AMA is saying that less than 1% of knee replacements are considered failures, whereas 59% of the population that get the knee replacement are considering them to be failures. So it just depends on who you consider. At $86,000, if 59% of people are unhappy with it, that's a huge, colossal waste of money. And we've seen in our clinic, people actually get results where they were actually able to go back and do the things that they love to do again in their life from one injection of regenerative medicine or amniotic stem cells, technically, if I'm being by the letter of the law, let's call it amniotic allograft, where you're taking tissue from the amniotic side of the placenta. Again, a product that is on label now for orthopedic issues. So when you see these clinics popping up and doing stem cells, I'll tell you, if somebody opened up right across the street from me, in all disclosure, I probably wouldn't like it. Any business owner doesn't like competition. But the truth of the matter is, the more this gets out there and well known, the more people are going to get better without the use of drugs and surgery. So, folks, you can't medicate yourself out of a chronic condition. It's not possible. You just can't do it. You can't go, I'm going to medicate my way out of high blood pressure, because as soon as you stop taking the blood pressure medication, blood pressure goes back up. You've got to change something. You've got to change your life. You've got to change something about your health in order for that to be achieved. In order for you to actually change the condition, you've got to change things, right? You can't just take a medication to resolve it. So I said, what's the deal? My title here was, what's the deal with all these stem cell clinics? Well, this is awesome news when other clinics are open up and doing this therapy. This is life-changing for many, many people. It's just not liked by the establishment medicine. I have orthopedics that I get to lecture beside who say that their practice has been fundamentally changed because of stem cell therapy. They go, I don't even have to do knee replacements anymore because of stem cell therapy. People are taking less medication, or having to take less ibuprofen, less over-the-counter medication, as well as less prescription medication. And whenever I see something that's in an article that says, the FDA doesn't approve of X, Y, or Z, I want you to just think back to a drug. I think it was called Vioxx, if I remember it correctly. So this drug was approved. This is FDA-approved medication for inflammation. So somebody had a joint problem, people take ibuprofen, they have a shoulder issue because they have a knee issue, because they have an elbow issue, whatever, and they were given Vioxx. How many people died from that? Do you even know? So the FDA approved this medication and later on came and said, oh man, we made a mistake. And over 50,000 people have been, deaths linked to Vioxx as a result of the side effects of that medication. And it was FDA approved. So every medication on the market, every medication that's been approved by the FDA, every medication that has been taken off the market by the FDA had one thing that had to happen first. It had to be approved by the FDA, right? So, I might get a little world of heat. I might get somebody send me a cease and desist letter or something because I'm talking about the situation with stem cells. And funny enough, I don't want anybody to shut me up, because you guys need to have this information. You need to know that truth of the matter is there could be a very short window where this treatment is available in the United States, like it is right now. Sorry, I got a little tickle in my throat here. That window may be shut. The pharmaceutical companies, with all their lobbying money and all their advertising dollars, may just actually take this therapy that's literally changed people's lives, helped them with COPD and MS and Parkinson's disease, and I even have a colleague out in Arizona who is treating people with Lou Gehrig's disease. He's on a clinical independent review board with the FDA, treating people with Lou Gehrig's disease, and actually seeing some success. He's not reversing the disease, but he's slowing it down and stopping it. That's what the clinical data shows right now. He, of course, isn't allowed to say that, but that's what the clinical data is showing. He can't advertise that. I mean, he could certainly say it, but he can't advertise it. He can't make a promise that if we did this therapy, we're going to reverse your Lou Gehrig's disease. That would be against the law. But this is truthfully, could be a life-changing therapy for so many people, and yet it is being squashed right and left because it doesn't make money for drug companies who only want to keep you sick. And I'm just telling you, I've got a conspiracy theory bone in my body for sure, and especially when it comes to the medical community. My uncle's a surgeon. unbelievable guy, saved thousands of people's lives. But one of the things he told me was that he was always on the reactive end of healthcare, handling people on the back end, not really doing a whole lot to help them become healthy, but handling the crisis side of things. And we need that. We need the crisis side of things because people haven't started to take care of themselves. But the truth of the matter is, what if you said, I want to start taking care of myself? Is it too late for me? This is the therapy. This is the thing that is actually shown. How do we get your body to make new cells that function in place of old and dying cells? All right. And I'll just tell you why, I want to give you some information. I'll probably say this on like 30 other videos over time, but when you're born, one of your stem cells, because you have stem cells through your whole life, when you're born, one of your stem cells can produce somewhere around 1 billion other cells every 30 days when you're a baby. That's one stem cell every 30 days can produce about 1 billion cells. By the time you are 35 years old, one of your stem cells can only produce about 32,000 other cells in a month. So you go from 1 billion to 32,000. Let's step it up. Let's move it another 30 years and say, what happens when you're 65? Well, one of your stem cells can only produce about 200 other healthy cells every 30 days. So what if you could inject new, healthy, young cells into your body that had the ability to replicate and create new tissue? Well, that's the promise and the science and the research in stem cell. And you'd have to do the research on your own. If I quote it to you here, you'd be really, really bored if you're not already. But also the research is available out there. When people say there hasn't been any research, folks, we've known about this technology since the late 60s. Okay, we've known how to clone stuff since the late 60s. This is not even remotely new, okay? And if it weren't for the internet and me sitting here talking to you and other people posting their successes and wins and trying other things and flying to the Cayman Islands and Panama and trying these therapies out and seeing do they work, the rich Peyton Mannings of the world and people who have actually tried this and paved the way and then had a voice. Honestly, the pharmaceutical industry and the FDA would have shut this down a long time ago, because this does not further the agenda. So folks, when you see these stem cell clinics opening up and you see an article and somebody's posting something that said, what about all these stem cells? This isn't regulated. First of all, that's not true. It is regulated. It's highly regulated. Second of all, it's good news. It is good news because it means that this therapy and this technology and this knowledge is getting more and more out there. Should you be should you have to pay too much for it? No, but the insurance isn't going to cover it. I jokingly say, let's say this is an insurance card right here, and you want your insurance to pay to fix you. It isn't going to happen. Okay, if I had a headache right now, I can't rub this insurance card on my head and make the headache go away. Insurance is not going to fix you. Truth of the matter is, neither is your doctor. I've been practicing for 21 years, and I've seen miracles in my practice. But you know what? I've never fixed one single person. All I've done is facilitated. The body has to heal itself. It's your God-given ability to heal that fixes you, not the doctor. So stem cell is, how do we take what's naturally given to you? What's the natural God-given ability for you to heal, and how do we enhance that? We're not trying to give you a chemical. We're not trying to cover something up. We're not trying to take that, the check engine light comes on your car. We're not trying to take a piece of black electrical tape and cover it up and say, there you go, you're fine, which is what most medications do. So we're actually trying to fix things, and you can be better. You should hold out hope. When I see some of these articles that say these stem cell clinics, blah, 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 and they're giving people false hope. Folks, that's not true. It's one of the greatest emotions we have as human beings is to be able to have hope in the face of all adversities, to continue to have hope. Somebody shouldn't prey on that hope. I agree with that. And people should be honest about somebody's success ability in doing a therapy like this, or any treatment for that matter. But I don't believe that medicine is being honest about their success rates. I don't believe medicine is being honest about their success rates regarding knee replacements. And hip replacements and shoulder replacements. Two wrongs don't make a right. I think everybody should be honest about their success rate. But I'll tell you this, that the clinics and the therapy and the clinics that I know, the colleagues that I know that are doing this type of therapy, stem cell therapy, regenerative medicine, using amniotic allograft, whatever you want to call it, whatever's compliant nowadays with the FDA and the FCC and whatnot, the clinics that I know are seeing results that are nothing short of what most people would call miraculous. So, does that mean there's no other miracles out there? Does that mean medicine doesn't do that? No. But I could tell you, this is one of those things that, first of all, it doesn't have any side effects, and you got nothing to lose for most people other than money if it doesn't work. And money is unfortunate, that is what we go by on so many aspects regarding our health. We'll do so much as long as it doesn't cost us anything. But I mean, I live in Middle Tennessee, and it's what's interesting is people will spend, they have no problem spending $5,000 on a new air conditioner unit if it goes out. They're like, oh, I will not live without air conditioning. But they have trouble spending a $25 copay to go have somebody check out their knees, or $3,500 for a stem cell injection for their knee. They'll get their air conditioning fixed. They won't get their knee fixed. They'll, most people won't do without their car. All right. They like that independence, but they think nothing about taking better care of that vehicle than they do their own body. So you got to just prioritize things. I just want you to know that there's solutions that are out there and help that's out there. So maintain hope. And if you want to know more about what the FDA is doing and stuff like that, just hit me up, write a comment below, and I'm happy to talk about any subject regarding health and wellness, because I'm not an expert on all of it, but I will tell you, I got an opinion on most of it. So I hope you found this helpful. Share this with your friends and family, and we will talk to you next time.